Classmates, today we are going to study the glossopharyngeal nerve and vagus nerve. The glossopharyngeal nerve is a mixed cranial nerve. It contains 5 types of fiber components. Let's take a look together. Special visceral motor fibers originate from the nucleus ambiguous, innervate the stylopharyngeus muscle. 2. General visceral motor fibers originate from the inferior salivatory nucleus, synapse in the otic ganglion, and then distribute to the parotid gland, controlling its secretion. 3. General visceral sensory fibers. Their neuronal cell bodies are located in the inferior ganglion of the glossopharyngeal nerve at the jugular foramen. The peripheral processes distribute to the mucosa of the pharynx, posterior 1/3 of the tongue, auditory tube, tympanic cavity, as well as the carotid sinus and carotid glomus. The central processes terminate in the lower part of the nucleus of the solitary tract, conducting general visceral sensation. 4. Special visceral sensory fibers. Their neuronal cell bodies are located in the inferior ganglion of the glossopharyngeal nerve at the jugular foramen. The peripheral processes distribute to the mucosa of the pharynx, posterior 1/3 of the tongue, auditory tube, tympanic cavity, as well as the carotid sinus and carotid glomus. The central processes terminate in the lower part of the nucleus of the solitary tract, conducting general visceral sensation. 4. Special visceral sensory fibers. Their neuronal cell bodies are located in the inferior ganglion of the glossopharyngeal nerve at the jugular foramen. The peripheral processes distribute to the taste buds on the posterior 1/3 of the tongue. The central processes terminate in the upper part of the nucleus of the solitary tract. D. General somatic sensory fibers, few in number. Their neuronal cell bodies are located in the superior ganglion of the glossopharyngeal nerve. The peripheral processes distribute to the skin behind the ear. The central processes enter the brain and terminate in the spinal trigeminal nucleus. 2. Points of exit and entry from the skull. The rootlets of the glossopharyngeal nerve attach to the medulla oblongata in the upper part of the posterolateral sulcus, and, together with the vagus and accessory nerves, pass through the anterior part of the jugular foramen to exit the skull. Within the foramen, the nerve trunk has an enlarged superior ganglion. Upon exiting the foramen, it forms a slightly larger inferior ganglion. After exiting the skull, the glossopharyngeal nerve first descends between the internal carotid artery and internal jugular vein, then curves forward medial to the hyoglossus muscle to reach the root of the tongue. 3. Vagus nerve. The vagus nerve is a mixed cranial nerve, and it is the longest and most widely distributed cranial nerve. First, let's look at its fiber components. It contains 4 types of fiber components. General visceral motor fibers originate from the dorsal motor nucleus of the vagus nerve in the medulla oblongata, are preganglionic parasympathetic fibers. They follow the vagus nerve and its branches distribute to various organs in the neck, thorax, and abdomen. They synapse in parasympathetic ganglia near or within the walls of the organs. The postganglionic fibers control the smooth muscles, cardiac muscle, and glandular activities of these organs. Special visceral motor fibers originate from the nucleus ambiguous in the medulla oblongata, follow the vagus nerve branches to innervate the muscles of the pharynx and larynx. General visceral sensory fibers. Their neuronal cell bodies are located in the inferior ganglion of the vagus nerve. Below the jugular foramen, the central processes terminate in the nucleus of the solitary tract. The peripheral processes follow the vagus nerve branches and distribute to various organs in the neck, thorax, and abdomen, conducting general visceral sensory impulses. General somatic sensory fibers. The sensory neuronal cell bodies are located in the superior ganglion of the vagus nerve. The central processes enter the brain and terminate in the spinal trigeminal nucleus. The peripheral processes follow the vagus nerve branches and distribute to the dura mater, auricle, and skin of the external auditory canal, conducting general sensation. Next, let's look at the points of exit and entry of the vagus nerve from the skull. The vagus nerve arises from the medulla oblongata by multiple rootlets from the middle of the posterolateral sulcus. It is slightly posterior to the glossopharyngeal nerve and exits the skull through the jugular foramen. Here, it has enlarged superior and inferior ganglia, branches and distribution areas of the vagus nerve. After the vagus nerve trunk exits the skull, it descends in the neck within the carotid sheath, located posteriorly between the internal jugular vein and the internal carotid artery or common carotid artery. At the root of the neck, it descends further. The courses of the left and right vagus nerves differ slightly. The left vagus nerve descends between the left common carotid artery and left subclavian artery, passes anterior to the aortic arch, then descends posterior to the left lung root to the anterior aspect of the esophagus, where it divides into many fine branches forming the left pulmonary plexus and anterior esophageal plexus. As it travels along the lower part of the esophagus, these branches gradually converge to continue as the anterior vagal trunk. The right vagus nerve passes anterior to the right subclavian artery, descends along the right side of the trachea, passes posterior to the right lung root to reach the posterior aspect of the esophagus, where its branches form the right pulmonary plexus and posterior esophageal plexus. Continuing downward, it converges to form the posterior vagal trunk. The anterior and posterior vagal trunks, along with the esophagus, pierce the esophageal hiatus of the diaphragm to enter the abdominal cavity, distributing to the anterior and posterior walls of the stomach. Their terminal branches join the celiac plexus, which is mainly composed of visceral motor nerves. The vagus nerve distributes to the dura mater, auricle, external auditory canal, pharynx, larynx, trachea, bronchi, lungs, heart, liver, gallbladder, pancreas, spleen, kidneys, and the digestive tract proximal to the left colic flexure, among many other organs. It is the main component of the parasympathetic nervous system. After injury to the main trunk of the vagus nerve, visceral activity becomes impaired, manifesting as palpitations, rapid pulse, nausea, vomiting, deep and slow breathing rhythm, and a sensation of suffocation. Due to sensory impairment of the throat and paralysis of the laryngeal muscles, hoarseness, difficulty speaking, choking, difficulty swallowing, and paralysis of the soft palate may occur. If one recurrent laryngeal nerve is damaged, hoarseness or difficulty vocalizing. If both recurrent laryngeal nerves are damaged, closure of the glottis occurs, leading to asphyxia. Next class, we will begin studying a new chapter.